many British people, the NHS is something that has a profound significance to them. It is a health system that they are really proud of and connected to. But for many Chinese students who study in the UK, the NHS implies disappointment and confusion, because many of them have had difficulty in accessing healthcare on the NHS. I was curious about why they have problems with the NHS and why they feel let down it. I want to find out the answer. So, what kind of problems have they met when accessing healthcare on the NHS?
But the only thing I could do was to wait for a doctor. I fell in a faint at about 11 o'clock at night, and I had a fever over midnight.
This is Ni Huilan, a Chinese student at the University of Brighton, shared her experience about waiting for a long time in the A&E when suffered cramp, diarrhea, and vomiting with me.
Although the nurse took me to a bed and gave me a painkiller, I still suffered the pain for about 3 to 4 hours. It was really a terrible night.
However, the truth is that it is easy for people to access healthcare and get treatment and medicine quickly in China, regardless of whether it is just a high temperature or a real life-threatening emergency.
And even if you are uncomfortable at midnight, you can still go to hospital and get treatment, and I think it's really convenient.
But why can people in China access healthcare and get treatment and medicine quickly in hospital, even when they only have a high temperature or a cough? Well, actually, Chinese people are used to going to hospital. Most of them believe their pain can be relieved by some treatment and medicine. Also, only big hospitals have professional doctors to give them high-quality treatment.
When I was in China, if I have fever, I'll go hospital and the doctor will basically check my body temperature and to see if I need to take a transfusion or just take some medicines.
Qin Lixiang, a Chinese student at the University of Sussex, also said that when he had a cold for 2 months, he went to the health center at the University of Sussex and hoped he could get some treatment or medicine, but he failed to get anything.
Doctors there, he didn't ask any question about my throat. He just asked me to take blood tests, and I said I just got sore throat and maybe I just need to take some medicals like some biomedics, and this kind of medicines can solve this problem quickly. And finally, the doctor didn't give me any medicine or transfusion.
Well, actually in British, doctors will only give antibiotics for specific cases. They will not prescribe them for high temperature or cough, unlike doctors in China who tend to prescribe more freely. Lu Yinghong, a nurse in the Peking Union Medical College Hospital, told me how Chinese doctors give treatment to patients who had a cough.
For example, if patients have a cough for 2 months, we will examine them and prefer to give a prescription to patients to relieve their symptoms. If it is serious, we may give an injection of antibiotics according to their condition.
Cultural diversity and differing habits lead Chinese students in the UK to feel disappointed and experience difficulty after they have been for healthcare in the NHS. The significant differences between the Chinese and the British healthcare systems also create a different expectation of the NHS among Chinese students because they are not familiar with the NHS and its structure.
Unless you've broken a bone, you're in a serious amount of pain, you're having an asthma attack, your life is in danger, you go to A&E then. When it's serious stuff, you go to A&E. Anything else, you go to a GP or you go to walk-in. Anything else.
Lottie Gree, a nurse who is working in the Royal Sussex County Hospital.
A&E, that would be for emergencies, broken arms, heart attacks, that kind of thing. Not that they're in the same realm, but... GP, for ongoing problems, basically. So, sore throats, coughs, colds, that kind of thing. And then, so for walk-in clinics as well, lots of people aren't registered with GPs, so you can go to a walk-in centre if you're not registered in the GP. Say if you're on holiday, you'd go to a walk-in centre if you didn't need to go to A&E.
However, China does not have general practitioners. China differs from the NHS, which regards the GP surgery as the basis of primary care. The hospital is the center of the medical system in China.
Generally, patients come to the hospital for outpatient services or emergencies, but they still need to register with a doctor before they can access healthcare. But this differs from registering with a GP in Britain. China does not have general practitioners. Registration in China is more like booking an appointment.
And this differs from the NHS, which is funded by tax and free for everyone. Every patient in China need to pay the registration fees, treatment fees, and medicine expense. China implements a medical insurance system, which is the module of combining social pooling and individual account. It is divided into 3 types, covering all enterprises and their employees in cities and towns.
我们的挂号费是根据医生等级划分的。
Registration fees are classified according to the doctor's level. Patients who see a more highly qualified doctor can pay more than patients who see a lower qualified one. China implements a medical insurance system, whereby patients who pay the medical insurance fees can apply for reimbursement of their treatment fees and medicine expenses according to different types of medical insurance. The medical insurance system in China is very complex because it can be classified into different types, and different cities use different percentages in their calculations.
类型，而且不同的城市有他们自己的划分比例。
On the NHS, everything is free, which is why it's so good.
Although people need to pay many medical fees in China, most of them still pour into big hospitals to seek treatment, because they believe that they can only get proper treatment from big hospitals with professional doctors. The lack of a GP system or similar systems cause various problems both to patients and healthcare service in China. The patient who really needs some urgent treatment may not receive it on time. At the same time, a great number of doctors also feel exhausted since they have to see huge numbers of patients per day, which is beyond their limitations. In some cases, patients may wait for half a day if they want to see a specialist in outpatient service, and pay a higher fee to illegal intermediaries who help patients to register, because registration for seeing a doctor is so limited. Different habits, culture, and healthcare systems cause different expectations of the NHS, which means it is hard sometimes for Chinese students to change. But what they need to do is to gain more knowledge of the NHS and adapt to the NHS.